Ambulance emergency. Can you tell me exactly what's happened?
My partner's gone into labour. If you can share at the moment.
Are you with the patient now?
Hang on.
How many weeks pregnant is she?
2 days today.
2 days today.
Yeah.
And her contractions are in progress?
Yes.
Is this her first delivery?
No, this is the sixth one.
6. Okay, how many minutes apart are her contractions?
How many minutes apart are the contractions coming? She's not answering.
She's not answering? That's okay. All right, does she have any high-risk complications?
Do you have any high-risk complications? Bleeding.
Bleeding?
Yes, so high-risk of bleeding.
A high risk of bleeding, okay.
Just hemorrhages after bleeding.
Hemorrhages, okay.
I'm organising help for you now. Stay on the line. I'll tell you exactly what to do next.
Do not try to prevent the birth, okay? So tell her do not cross her legs.
We've got multiple crews on the way, guys. They're trying to get there as fast as they can.
That's a contraction? Okay. What can she feel out?
You don't need to tell me. I'm telling you what to do about it.
What part of the baby is out? Can you see the head? What part of the baby can you see?
I don't know.
Tonight, a very hard landing.
He's laying in the middle of the road. Take a big deep breath in.
A 4-year-old's heart emergency.
Are we getting a reading on Sam? No.
It's too fast.
We're coming to you with a 4-year-old male from home, a heart rate of 210.
And
Second confirmed code, sir.
a mystery in a graveyard.
I don't know what's going on.
Oh, it's crazy.
Can you see the head? What part of the baby can you see?
Lillian is on a call with the partner of a pregnant woman who is full term and in labour. He's the only other person at home and may have to deliver the baby on his own.
You can see the umbilical cord. Can you see the head? Can you see the arm or the shoulders?
No, I can't see the head and the shoulders. Well, hang on. You think it's the head? It's the head.
Okay, so with each contraction, I want you to place the palm of your hand against her vagina and apply firm, gentle pressure to keep the baby's head from delivering too fast, okay, or tearing her.
Paramedics are en route, but are still about 10 minutes away.
Okay, so as the baby delivers, I want you to support the baby's head and shoulders and hold its hips and legs firmly. Have her push hard to get the baby out.
She's fine.
Okay, let me know when that next contraction happens. It's completely out?
Yeah.
The whole baby is completely out or just the head?
Not completely out. Baby's been delivered.
The baby's been delivered? Okay. Okay, is the baby crying or breathing?
Yeah, she's got the tongue moving and the finger rubbing in.
Oh, excellent.
Okay, so gently wipe off the baby's mouth and nose. Do not cut the cord.
I'll just make a confirm, is there any serious bleeding? Because Mum said that she had a high risk of hemorrhaging after birth. Is there any bleeding at all? Any cramping?
No cramping.
Okay, good. All right, you just let me know if anything changes.
What did we have? Is it a baby boy or a girl?
I'm pretty sure it's a little girl.
Oh, congratulations.
Little girl.
Oh, congratulations, guys.
The ambulance guys are here right now.
Oh, excellent. Are they right there with you?
Yes.
Wonderful. Okay, congratulations, guys. Take care. All the best for you and your new baby.
Thank you very much.
You're welcome. You're welcome. Bye-bye. That was actually crazy. Oh, bless. There's a little girl, baby number 6.
Let's go. Happy birthday, baby.
You should call her Lily.
Each year, New South Wales Ambulance assists in the delivery of almost 500 babies.
Do you need a water bottle filled?
Yes, actually, I do.
It's 6 a.m. at Liverpool Superstation in Sydney's southwest, and paramedics Hayley and Jazz prepare for today's shift.
I reckon by the time your generation actually reaches...
My generation.
Yeah,
You're
because
you're not even that much older than me.
we are, I'm basically
You're
your
really
mum.
not that much older. Mentally, I'm like, I'd say at least 57.
You're 57?
Mentally. Yeah.
Yeah, right. So currently I'm a dual specialist, so extended care paramedic and intensive care paramedic. I'm most proud of having both specialities behind me, particularly because I did that being a mum. So I'm a single mum. Zara is 9. She's the most important person in my life. She's a little firecracker. She's hilarious. She's the best thing I ever did. Do you know what happened last night? Me and Zara went to bed a bit late, and I was like, we're not getting much sleep tonight, Bubba. Mummy's got to get up early. And so at midnight, 1 a.m., 3:30 and 4:30, she decided to kick me.
Ambulance emergency, what town or suburb?
At Sydney's control centre, call takers respond to 75 calls every hour.
And my baby's 9 months old. He's having an allergic reaction, and I've just given him an EpiPen.
Is there any serious bleeding? Are you still doing compressions?
It's really important for you to be calm because you're going to keep her calm, okay?
Now, other than her head, was any other part of her body injured?
Ambulance emergency. Tell me exactly what's happened.
My son, who's 4 years old, he has a history of VT, and I just need someone to come and check on his heart rate.
Okay.
To get tells that catches up.
And you said does he have a history of heart problems?
VT.
Ventricular tachycardia, or VT, is a fast, abnormal heart rhythm. If VT lasts for more than a few seconds at a time, it can become life-threatening.
And is he awake?
Yes.
Is he breathing?
Yes.
Is he changing colour?
Looks a bit yellow to me.
He looks yellow.
A little bit.
So we have some help organised, okay?
Yeah.
Stay on the line and I'll tell you exactly what to do next.
4-year-old male, conscious breathing. He has a history of VT. Now he has a high heart rate. He's yellow.
I always get so anxious when it's kids.
Yeah.
On the way to some cases, my heart races a little bit. The worst job you could ever be given is a child that's critically unwell.
Eyes. Honestly.
I, as a mother, think about my own child probably in that moment, and I just can't imagine how scary that would be for that parent.
Okay, that's, yeah, here.
I have to remember that I need to try and have a few deep breaths and centre myself so you can perform the best you can. Hello. Are you Mum? I'm Hayley.
What's going on?
He has a fast heart rate.
How do you know it's fast?
He gets a fever when that happens. Come down,
Let's have a little feel, my friend. And is he on medication?
Yeah.
Beta blockers? Oh, okay, all right.
Mama, can do
Hang on, I gotta put them on quickly and then you can take them off, okay? Let's go to check what your brother's heart rate's doing.
You got it right, yeah.
203.
Mum knows best.
Adam's heart rate is over 200 beats per minute, dangerously high for a 4-year-old. Untreated, it could lead to a cardiac arrest.
We need to get the patient to hospital as fast as possible.
Ready? It's got to get tight. It's got to check your muscles. Okay, you need to see that dot there? I want you to put that one on. I need lots of help, okay?
Intensive care paramedic Hayley and partner Jazz have been called out to a 4-year-old boy with a dangerously high heart rate.
We're all going to practice being super still. Ready? No one's allowed to move. The first person that moves loses, all right? We're going to stop moving now.
Adam's heart rate is over 200 beats per minute. A normal heart rate at that age is between 80 and 120.
Okay, we can move now.
Good job.
Are we getting a reading on Sam? No. Probably because he's in SVT. We're going to have to take him to hospital because he's in SVT currently. This is SVT.
SVT is a fast, abnormal heart rhythm that starts in the upper chambers of the heart and, in extreme cases, can lead to a cardiac arrest.
I get a second crew.
Yeah.
884 Sydney. I'm sorry, okay, but you got to keep. Yeah, thank you. Confirmed 4-year-old SVT. May we please have R1 back up, please?
Due to the severity of Adam's condition, Hayley calls for a backup crew.
Would he be okay coming with us without you or not? Yeah. Yeah, okay. That's all right. We might get him carried out. I don't want him walking.
I'll carry him out. But I'm going to carry you out to the car, okay?
You want to go with Princess Jasmine?
I can walk.
Nah, we don't want you to walk.
Why?
Because your heart rate's too fast. All right, I'm going to put my arms under.
Why?
So we're not. It's Princess Jasmine. I don't like seeing sick kids because I really feel for the family. I feel for the parents.
Watch your fingers.
And it can be really daunting to think that you might be the difference between them coming home to their family and them not coming home to their family.
Adam, Baba's gonna go to hospital soon, okay? We'll see you there, all right? Je black Shuman Han.
So we go above and beyond for children that are in a critical condition. They've got their whole lives ahead of them, so we will do the very, very best we can. Hey, which one of these do you like?
Two.
You want two?
This one? Oh, this one's super soft.
Is that 200 at the moment?
Okay. All right, so let's just go through a quick plan.
Hayley and Jazz will attempt to lower Adam's heart rate instantaneously using a special breathing technique that doesn't require medication.
Yeah, do you want to play a game with us?
Yeah.
So what we're going to do, right? We're going to pretend that we're going to be blowing up a big balloon, okay? You got to blow up the big balloon. So Adam's going to blow up the big balloon for 15 seconds, okay? And then we're going to go on a roller coaster. That sound fun? After 15 seconds, drop, and I'll raise the legs. So big balloon, roller coaster. Okay, ready? Blow up the balloon, blow up the balloon, blow up the balloon, blow, 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 blow. Constant blow.
Hard.
I can see the balloon getting bigger.
They attempt the Valsalva technique, a breathing manoeuvre that can help restore heart rhythm.
4, 3, 2, 1. Roller coaster! Woo!
The success rate with young children can be low due to the single, prolonged breath required.
Let's try again.
And I'm going to tilt you back really quickly as well, okay?
And we're going to do one big constant blow, okay? Are you ready? Big breath in. Now go. 15, 14, 13, 12, 11, 10, 9, 8,
One big
7,
breath, big breath.
6, 5, 4, 3, 2, 1. Roller coaster! We might get going.
Afternoon from 884. We're coming to you with a 4-year-old male from home, currently monitored in SVT.
Adam's heart rate is still dangerously high, so drugs will need to be administered in hospital.
I might get an ice pack and try that. On your neck. Are you happy for that? Ready? Head forward for me, sweetheart. Oh!
It's really hard watching a child that's critically unwell. But as an extended care paramedic, I've always loved being challenged. I like using my brain and I like using my skill set to be able to make a difference in their outcomes.
Do you want to have a look in my eyes? What colour eyes have I got?
Blue.
Blue? Can I have a look in your eyes? Oh, yours are brown.
Just arriving.
We're here. Do you want to come and see my friends? There's lots of doctors and nurses and some of my friends that are ambos as well. You want to come and meet them? You know what? You're my favourite patient today. It was actually quite a serious problem that he had, and it really had the potential to go really bad. Look, this is my friend Jim. And we managed to get him here without any issues, so that went well. It was stressful, but hopefully he'll make a full recovery and he'll be home tonight with his siblings.
We've got a radio that we listen to. You can listen to between calls. Oh, you listen to yeah, and sometimes you have like a silent disco. Everyone can listen to the same song through their headset, but you can't hear anything. It's like a silent disco. Just wait till they start playing old school Bon Jovi.
A truck's flipped or car's flipped? Truck's flipped, yep. And 2 cars.
Is the front of the car completely destroyed, completely caved in, is it?
Is she having any difficulty breathing?
If she becomes less awake or starts getting worse, tell me immediately.
Ambulance emergency. What town or suburb?
I don't know the address. It's the cemetery.
Tell me exactly what's happened.
This man has fainted. He's not well. He's on the floor. He's not breathing.
He's not breathing?
He's showing pale and losing colour.
All right. How old is he?
How old is he? I'm not sure.
Tell me.
He's 60.
All right. Well, ma'am, take a breath. Take a breath.
I'm organising that help now.
He's not breathing. I can see him. He's not breathing. He's not speaking.
Listen to me. Lay him flat on his back on the floor and remove anything under his head.
Flat on the back?
Yep, remove anything. One person talking only, please.
Sir, lay flat on his back. We need to help him now.
We need to do resuscitation.
Place the heel of your hand on the breastbone in the centre of the chest, right between the nipples. Place the other hand on the top of that hand.
We're going to pump the chest hard and fast, at least twice per second and 5 centimetres deep.
1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4.
Let the chest come all the way up between the pumps. We're going to do this 600 times or until help can take over. Listen to my instructions, so you're doing really well. 1, 2, 3, 4.
1, 2, 3, 4.
1, 2, 3, 4.
Okay, I know this is a stressful thing for you all there.
But keep going. Don't give up on him. You're going to keep him going till the ambulances get there.
Laura, the cemetery dog taking Sydney to 660. What is your approximate ETA to scene? Copy, 6 minutes, thank you.
Responding to a code 2, a cardiac arrest, paramedics are still 6 minutes away. An intensive care team is 8 minutes from the scene, and police are also en route to the cemetery.
1, 2, 3, 4.
Thank you,
1,
that's perfect.
2, 3.
Okay, we've got multiple ambulances on their way to you, okay? We also have the police coming to give you an assist there, sir, okay? So they will take over CPR when they get there, okay? Are you still pushing on the chest?
They're just making me right.
All right, I'll leave you in their care. All the best.
Thank you so much.
You're welcome.
For your help.
You take care. All the best. was a panicky scene. They're obviously at a cemetery and they're very, very heightened scene with lots of family members, and those jobs are so hard.
Okay, 2 police are on scene. First ambulance is on scene. So they're doing CPR and... Copy that. Second code 2 on scene.
Laura, there's a second code 2 at the cemetery.
The patient is being treated by paramedics.
There's a second code 2.
But a report has come in that a second person has suffered a cardiac arrest.
Second confirmed code 2.
Second confirmed code 2.
Call taker Joe has just helped a distressed caller perform CPR on a man who's collapsed at a Sydney cemetery.
Copy that. Second code 2 on scene.
Laura, there's a second code 2 at the cemetery. There's a second code 2.
With paramedics already attending to the man, police have called in a second cardiac arrest at the same scene.
So we need a second IC then?
Yep, 2 patients. Right now we've got to mobilise our resources.
Sydney to 338. Going to assign you to a second code 2 on scene at the cemetery.
I don't know what's going on. It seems very odd, and it's all in the same area.
Without knowing the full circumstances surrounding the 2 cardiac arrests, Sydney's control centre dispatchers call on more resources in case this becomes an even bigger emergency.
Sydney 2335, yeah, if you guys could attend as well, please.
One of our road retrieval teams or medical teams, which has got a critical care paramedic and also a doctor on board to head there and be on standby in case this becomes something more than just 2 coincidental cardiac arrests.
Police, intensive care paramedics and a second paramedic team are already on site. A further 2 ambulances are on their way, as well as a medical team with a doctor. With fears that the 2 collapses could be related to an environmental hazard, fire and rescue are also on standby.
In the same scene. Yeah. So we're treating it as hazmat until otherwise. Hey Wendy, it's Laura from Sydney Ambulance. How you going? They've got a second patient that the ambulance confirmed is code 2. So they're running 2 separate arrests now. I mean, police are already there. They're all in the same area, so we're just kind of going to we're querying maybe like a hazmat thing until proven otherwise.
A hazmat response is called in when there's the possibility of hazardous materials or gases at the scene of an incident.
It's fire rescue attached.
Yes.
As a hazmat?
They're en route.
They're on
the hazmat, yeah,
right.
through the RTO.
Oh, wow. That's crazy.
Inspector 95 confirms 2 patients.
There's still, obviously, the executive's still kind of erring on the side of caution. We've still got a medical team heading there just in case they do happen to find any other patients. Do you know if they knew each other? Okay, all right, so they'd come from the same location. Okay, all right, amazing, perfect, that's all I need to know. Okay, so she's just confirmed it was a mother and son, the 2 patients. So they had come from the same location, they were visiting a tombstone, and they've both arrested.
With the emergency confined to 2 family members, the hazmat team is called off.
God, mother and son.
Yeah,
It's crazy. Sad. Oh, that poor family.
At Northmead Superstation, paramedics and best friends, Alyssa and Ella, are about to clock on for the day.
How's your weekend? Good, how was yours? Yeah, good.
I think your relationship with your paramedic partner, it's important because you spend so much time with each other in such a close-knit space. So my work partner is Ella. I've never had a friendship this close. We never get sick of each other. She makes me laugh. She is very loyal. So Ella is like a sister to me. I'd have to say the best thing about this job is the girl gang that you get.
I 100% agree.
Having all those loyal women behind you.
We would never have met those girls if we didn't work here.
We wouldn't have met.
We wouldn't have met. It's really weird. I always think it's so weird that we went to high school together and then we worked near each other and we went to the same gym, but we never met till we were in this job. Now you can't get away from me.
I can't get rid of you.
Now you can't get rid of me.
A car hit a motorbike when he was coming out with an accident and the guy fell off his bike.
Okay, I just have a few questions. Is anyone trapped?
A trapped? No.
Is he breathing?
He's breathing and he's conscious.
Any obvious injuries you can see?
We just had to touch his leg and he said not to touch it. Is your leg hurting? Yeah, his leg's hurting.
I'm organising help for you now. Stay on the line. I'll tell you exactly what to do next.
We are going to a car versus motorbike accident.
About 25% of all people seriously injured on New South Wales roads are motorcyclists.
The motorbike rider is currently injured. He's laying in the middle of the road.
So one thing.
A motorbike collision resulting in an injured but still conscious rider is classified as a 1C trauma emergency. Paramedics Ella and Alyssa are 8 minutes away from the scene, just behind the police response. An intensive care crew is still 30 minutes away.
We might need police for traffic control. We might need fireys to clean up the actual scene.
I have done quite a few, motorbike accidents where the patients have been seriously injured. I think that would be because they weren't wearing the appropriate protective gear. When I'm on the way to a motorbike accident, I'm thinking about spinal injuries, fractures. I'm actually scared to ride motorbikes because I had a very good family friend die in a motorbike accident when he was 25. A motorbike accident sometimes can be a hard job for me. I've always been very aware of what could happen. If he has injured his back, he probably can't walk too, so we'll probably need the extrication gear. Clear on the left. Because I have been on the other end of seeing someone pass away due to a motorbike, the police have just arrived on scene. I'm wondering if they're wearing the correct personal protective gear. It could be the difference between life and death.
In Sydney's northwest, paramedics and best friends Ella and Alyssa have just arrived at the scene of a collision between a motorbike and another vehicle.
Hello, I'm Ella. What's your name? Jason. You right if I just undo this?
Oh, my legs.
Your leg? All right, take a big deep breath in for me. Any pain there?
No.
Just gonna start by feeling your head. Were you wearing a helmet today?
Yes.
Can we grab the helmet just so we can have a look to see how much damage there was on the helmet? Due to the mechanism of someone involved in that type of accident, you need to really do spinal precautions. That's obviously protecting their head, neck and spine, just keeping them in a neutral position. Do you know if you lost consciousness when you came off the motorbike?
He didn't. I was here.
Okay, beautiful. It could have an adverse outcome if we didn't protect them properly. Do you have any pain here in your neck?
No.
How's your back? Any pain down your back? Can you feel me touching there?
I can't feel it.
Okay. Can you wiggle your toes for me?
Toes?
Yep.
Yeah.
Do you have any pain anywhere?
Shins
Yep.
and left leg
Yep.
and left right hand.
Okay. Any pain down your arm?
Yeah, that side. Yeah,
Okay.
that side.
Okay. Take a big deep breath in. Okay, Liz, so we've got some arm pain, if you can come around there. Just take my hand. I'm just going to take this off, okay? Too painful?
Jason is in obvious pain, but Alyssa and Ella can't assess the full extent of his injuries until they remove his protective gear.
I'm going to cut your jacket off so we can have a good look at your arm, okay? Then I'm going to give you some pain relief.
Not the jacket, hey?
I know, sorry. It doesn't matter in the end because it's done its job and protected you.
It has.
All right, so Alyssa's just going to keep cutting that off. Does have a compound to humerus.
Oh,
Don't look. That's okay.
Don't look.
You're all good. That's all right. Don't look.
Jason has a compound fracture of his upper arm and the bone is poking through the skin.
I'm going to put this in your mouth, okay? You're going to breathe in through your mouth and then out through your nose, okay?
With the full extent of his injuries still unknown, paramedics administer the green whistle, an emergency analgesic to manage his pain.
He'll probably need some further pain relief that we can't provide. I see it's coming. Okay.
The intensive care team is now 2 minutes away from the scene.
It's very important having an intensive care paramedic at the scene with us, as they can provide different intervention and drugs which can improve the outcome.
So the plan is we've just got another crew here, okay? Hi, guys. So this is Jason, he's 25 years old.
Intensive care paramedics are authorised to administer stronger pain relief drugs like ketamine.
Thinking maybe some ketamine or something for pain, or if we can just get some morphine drawn up.
I've got 5 milligrams midazolam here. I've got 200 milligrams ketamine here. So we're going to see how he responds to it.
Yeah, let's get the board.
And when extricating the patient from scene, we would use the spine board.
And then we'll get you onto the bed and take you up to the hospital, okay?
We want them to minimise movement.
Traction.
1, 2, 3, 6.
All the paramedics work together to make sure that we protect that patient as best we can.
You're doing really good.
Jason's in a lot of pain, so we really need to get him to hospital as quick as we can.
Hi, Jason. How's your pain at the moment? Pardon? I have no idea. You have no idea? That's good. That's good. Jason, there's a bit of noise. From our siren and our talking, okay? But you're perfectly safe. Just on our way to the hospital, okay? Oh, can they be repaired? Yeah. Your bike, no, but your body, yes. Some things will probably just heal. Others will need surgery, okay?
I've always been against riding motorbikes. But since I've gotten older and being a paramedic, I'm very aware that people just need to live the life they want to do. And if that's enjoying motorbike riding, then it's definitely up to them, as long as they wear the right equipment.
Jason, we're just at the hospital, okay? You're doing really good.
In Jason's case, he did have multiple injuries, but if he wasn't wearing all that gear, I can only imagine what the outcome, could have been.
So Jason got off pretty lucky. Lucky he was wearing all the equipment, because the other car was going 50 Ks when it hit him. His body took most of the impact. Yeah, that left side. Broken arm, broken leg. Look, I don't think he'll be riding that bike anytime soon. Those injuries obviously will affect him for a long time to come, and his recovery will probably be long. But yeah, he is lucky. Oh,
Poor guy.
Yeah, poor guy.
If you could do any job, what would you do?
I would do rugby league commentary.
Commentary, okay.
But not the commentary, not the person that calls out every single pass. Just like on the panel that talks about the game.
Okay. I'd like to do like interior decorating. Spend other people's money.
At Bankstown Superstation, husband and wife paramedic team Kane and Michaela have almost finished their shift.
Oh, I've got the spag bowl.
Yeah.
No, I could have eaten that. I'll save that for dinner.
This roster, Kane and I, were lucky enough to work with each other. We've been paramedics for 10 and 11 years. Normally, I'm on an opposite shift to him. We would be like ships in the night. And to have this opportunity to work together is pretty special.
Kane and Michaela have been called to a nursing home where a 91-year-old man is presenting as very unwell with vomiting and diarrhoea.
Copy. He's blue around his eyes.
Interesting, okay.
He's 91.
Among the elderly, these symptoms can lead to severe dehydration, which is life-threatening. There are approximately 185,000 people in aged care in Australia, with 60% of those aged 85 or over.
He suddenly deteriorated. He started vomiting.
Yeah.
And then he looked pale.
Any diarrhea?
Yeah, he had a big amount of bowel
okay.
as well.
Okay.
He keeps vomiting. Dad, can you hear me? He's got a bit of a crackle.
Hello, Leonard. Hello. My name's Michaela. I'm from the ambulance. You're not too well this morning, hey? Yeah. Leonard, I'm just going to do your blood pressure, okay? How long's your dad been here?
Oh, about 5 years.
Okay.
After Mum passed, he was on his own. It was just because he got dementia. And
Okay.
It was too bad.
Yeah. So it looks like he's got an infection somewhere, sounding like his chest. Yeah, so he's got a bit of a fever as well. Yeah. We're going to go up to the hospital today. It's all right, mate. You're safe. It's okay.
All right, man.
Let go.
It's okay, bud.
Let go.
It's okay, Dad.
I do have a soft spot for the elderly. They are some of my favourite call-outs. Their strength and their resilience, I admire.
On 3. 1, 2, 3. All right, you're on our ambulance stretcher now, okay, Leonard?
They've been through a lot, and I hope that, when my parents are at an age where they need help, that I would be able to repay them and help in their old age.
Beautiful photos. Wow. It is not. They're beautiful. Oh, I love seeing these old family photos.
90% of our job is about talking to people. I think treating them with kindness and respect is something that I've always been taught.
My dad actually took that Mona Lisa.
Oh, wow.
Well.
Wow.
Yeah.
That's amazing. Is this his favourite hat?
Yeah, he had it on before.
Did he? Oh.
Gentleman carries a hanky and has a hat.
Yep.
He tilts their hat.
Yeah.
Yeah, my pop always.
Always had the hanky.
Yeah. Well, he said, and the hanky's for in case a lady doesn't have one or is emotional.
Oh. What a gentleman.
Don't make them like Leonard.
They don't make them like that.
No. Right, Leonard, let's go. Hi, everyone.
It's not always about the medical problems. Sometimes it is nice to get to know the patient, and it's nice to be able to share those things that can remind you of your own grandparents.
Leonard, I just want to have a look here. Where's your arm? Thank you. Can I hold your hand? That's it. That's nice. That's okay. You're safe in the ambulance now. Yeah. Just gonna pop some dots on you.
He had dementia, and it was nice to hear his daughter say, you know, what a gentleman he always was. Always carried his hanky, always had his hat. Every time he met someone, he would lift his hat to say hello. But yeah, seemed like an absolute gentleman before his dementia sort of progressed.
Make you feel a bit more comfortable, okay? We're going to hospital. Your daughter's gonna meet us up there, okay? Yeah?
It is heartbreaking when they were once, you know, young, just like Kane and I, you know.
We're here now, okay? At Prince of Wales Hospital.
I love that old traditional man, well-mannered, putting the woman first.
Thank you.
Those sort of things I'd like to instill into my son.
We are going to do a birth. Yeah, that's what we're going to do.
I would love to deliver a baby.
Sometimes I think you should have been a midwife.
Yeah.
Considering you birthed your own child.
Yeah, it's easier when you're not the one pushing.
Yeah.
The day my son was born was the 17th of July, which is actually Ella's birthday. I was at home, had a bit of a contraction, and I said to my husband, I think we should make our way up to the hospital. So we walked down to the car, my waters broke on the footpath. No one tells you how quick your second baby can come on.
Yeah, that's it.
From like the first contraction to when he was born, it was probably about 15 minutes. And yeah, I was in the front seat of the car on the side of the road. My husband delivered him. It was hectic.
Northmead paramedics Ella and Alyssa are almost at the end of their 12-hour shift, and dispatch has assigned another job.
331, a pregnant lady who's passed out and her water's broken, patient vomiting, at a medical centre.
Copy, drop it down. Okay, so we're going to a 24-year-old female, pregnant, query passed out, query waters have broken. Pregnant and passed out.
Mate, those contractions will do that to you.
She's in her third trimester. Patient vomiting.
It's happening. She's clearing out.
Each year, about 5%, or just over 200,000 ambulance call-outs in Australia, involve women in labour.
This is like your dream job.
No one calls us because they're having a good day, you know? But if if everything goes right, it's like the best day of your life. Where is she, 38 weeks?
A woman at 38 weeks pregnant is considered full term.
I wonder what made her come here.
Yeah, I just thought the same thing. Feels like you were reading.
Hospital.
It's like you were reading my mind.
I feel like I live in your mind.
You do. Hi, how are you?
I would be so honoured if I were to be a part of someone else's birth story. If I could help them, you know, bring life into the world. I just think it's a beautiful little life cycle. Hi, Casey, Alyssa and Ella. Have you been having any contractions?
I'm going to go with no because I think I feel pain if I have like severe pain.
Yeah, you look pretty relaxed.
It feels like really, like I'm constipated.
Yep. Why did you come here in the first place?
I had an appointment for my toe.
Oh, you came for your toe. Came for your toe and then we're going to have a baby. Okay. Okay.
I started to feel like sweaty.
Yeah, and then...
And then she said, we'll lay down, and then I was walking.
Okay. So you don't know your water's broken, but someone else's...
They said.
Okay, cool. All right, love. We'll get you down to the ambulance.
Casey is not in labour, but her waters have broken, so she'll need to be examined in hospital.
Do you know what you're having?
A girl.
A girl.
I was just about to ask you if you knew if it was a boy
How
or girl.
exciting.
Hello,
Yeah.
how are you?
Your mum?
Proud to be grandmother.
Yeah.
Is this your first grandchild?
Yes. How exciting. Yeah. And babies just bring the whole family together.
I'm telling you, it's got to be today.
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 Birthday tomorrow. Oh my, both of yours.
Both of your birthdays.
That's weird. If that.
Mum, Dad, and then.
Oh, tomorrow, and then maybe that's just the date that runs in your family.
How bizarre.
I just told you this.
She's like, I want a quick labour.
Today.
You have one birthday dinner. All of you.
Or, like...
All right, let's get you in the bed.
Now, are you riding up with us, Mum, or... Yeah, cool. All right, Casey, I'm going to be riding back with you. Being a mum changes you on every level. Your heart beats differently and you walk differently and you protect differently. And I think it's even made me work differently because you appreciate life on such a new level. We couldn't work out what to call my son, and I really like Jack, and my husband was like, wanted like all like the basketball player names, like LeBron. I'm like, we're not going with LeBron. He's like, fine, and his middle name can be Manly after his favourite football team. And I was like, oh, it was pretty funny. Like, no one will ever know. And then a lot of people knew. Jack Manly.
So it is Jack Manly.
I became a paramedic because I once had to call an ambulance for my own mum. And I remember sitting in the front seat of the ambulance on the way to hospital, and I thought, yeah, I could do this. So, yeah, I never take the uniform for granted. We're at the hospital now. We're exactly where you need to be. How exciting, you're gonna meet your baby.
Hopefully not tomorrow.
Okay.
Is there any information about the whereabouts of the dog at this stage?
Next time...
There's people that have died from dog attacks. It's like they can do some damage.
A shopping strip nightmare.
Oh, it's been to a shop front. Okay.
No, it's okay. I'm sorry that you've gone through this. It's not your fault.
And...
Can't come and check him every morning.
the lifesaver next door.
Lucky the door is open.
I'm a tough bugger. Tough bugger.